It's sorry, it's a 2-year
Sorry
program. It's
about that.
called
I
a 2-year.
started recording.
Oh yeah, that's okay. So it's a 2-year foundation program, and it's split into foundation year 1, which is your main internship year, and your year 2, which is building on what you learned during your internship year or during the first year. You're not treated typically as interns. You're given a lot of responsibilities, so it's not and you're paid. So it's not like you're not treated like an intern in India or in Sri Lanka. This program is split into 6 4-month block rotations of your choice. So you choose what departments you want to work in, and it offers a learning by doing opportunity. So you get to do whatever you want to do. You ask for it to be done, and you can learn that way. And it's very well supported in terms of the fact that we've got mentors, we've got supervisors, you've always got someone around that can help you and support your learning. So I would say that the biggest thing is, so there's different types of foundation programs. There's not just clinical stuff. So the specialized foundation programs, which are quite research heavy, teaching heavy, management skills. So if you're not a very clinical person, if you like the more administrative side of things, of running a hospital, or if you like research, there's this opportunity to join a specialized foundation program where you would do 3 months of research and 1 month of clinical skills in that department. There's also priority foundation programs where, and this is opened in areas where that has been proved difficult in attracting doctors. So typically places that don't have a lot of multicultural areas, or places that don't have. So these are places in the UK itself that are maybe islands. So we have the Isle of Wight, the Isle of Man. They are islands. You don't typically have a lot of people, so you've got a small population. Not many people want to work there because it's difficult to travel home, things like that. So there's opportunities to join those foundation programs as well. There's a psychiatry heavy foundation program where you would just do 2 years in psychiatry. And the one that I'm doing is a 2-year foundation program in 6 different rotations. The biggest, I would say, hurdle is getting your eligibility straight, getting your eligibility and your timeline. So the application process to the UK Foundation Program is on an organization called Oriel, or an application called Oriel. It's very simple to use. It looks a little old, looks a little outdated, but I promise you it's easy and it's simple to use. The things that you would need to prove you're eligible to join the foundation training is your proof of ID. So that could be your passport. A dean's statement is a form that needs to be filled by yourself and then signed by your dean, the dean of your medical school. And these dean statements typically come out in June or July, for the next year. So let's say you're you're starting your application in 2024. Your application, so your dean statement will come out for 2024, but you will start UKFPO in 2025. You need your medical degree translated into English by a recognized organization. So I use Straker Translation, which is recognized by the GMC and the UKFPO. So a lot of people are confused by the GMC and the UK Foundation Program Office, or the UKFPO. The GMC is a licensing body. It is your registration. So all of your all doctors in the UK are under the GMC. So that's the medical licensing or the medical registration. Whereas the UKFPO is just it's an organization that was created to help post-graduation after you finish graduation, help doctors in that process. And So I know PLAB and UKMLA have been a hot topic for quite some time because it's difficult to get PLAB 1 seats. You do not have to worry if you have not sat PLAB 1 before applying. You do not have to worry if you've not been able to secure a PLAB 1 seat, because through the UKFPO, you will be given a specific PLAB 1. So you will be given priority PLAB 1 seats. You need to do IELTS and OET. IELTS, you need 7.5 in each domain, and OET, you need 400 in each domain. The right to work, visa stuff, you can figure that out later. Now, if you've taken a year out of training, if you've taken more than a year out of training, actually, you would need to sit something called the National Clinical Assessment. That's an exam that's very similar to PLAB 2, easier than PLAB 2, but very similar to PLAB 2. These are the different places that you'd be able to apply to PLAB once you finished your whole PLAB 1, PLAB 2. Once you get into the UK Foundation program, these are the deaneries or the counties that you'd be able to get into. So I'm in the peninsula, so I'm in the southwest of the UK. Yeah. So my timeline worked somewhat similar to this. So first, I answered IELTS in May of 2022. When did I graduate? 2021. And then I started my eligibility. So I applied, I got my dean to sign my dean statement, put everything onto Oriel. Once I was deemed eligible, the national application starts sometime in September, October, sometimes even November. In this national application, all British medical students who have just graduated, as well as international medical graduates, will apply together. The application would mean you put in the preferences of your choice. So let's say you want to work, you would prefer to work in London, and then your second choice would be Oxford, your third choice would be Wales, or things like that. So you put it according to your preference. You'd actually arrange them according to your preferences. Now, because there's no situational judgment exam, there used to be a situational judgment exam which would rank you, and then based on your rank, you'd be able to get into the deanery of your choice. There's no longer the situational judgment test, and now it's just computerized. So let's say, for example, you've already arranged your first choice as London, your second choice as Oxford, and your third choice is Peninsula, and all the way down to the bottom of the 19 deaneries. You're then a computer allocates you a rank, and places are filled according to the rank. If you're not in the first set of allotments, you will be allotted your second choice. And then if you're not in the second, so on and so forth, you get allotted to your third choices. Once the results of your preferences are out, you then rank the specific hospitals that you'd want to work in that deanery. So let's say in the peninsula, there are 5 hospitals. In the southwest of the UK, there are 5 big hospitals. You either rank the hospital that you want to work at, or you rank the jobs that you want to do, or the departments that you want to work in. Now, PLAB 1 in this scenario figures out here. So just before your national application and just before your results of your preferences come out, that's when you will answer your PLAB 1. And PLAB 2, you will answer after you've ranked your specific hospital or job. The visa, all of that comes much, much later. And finally, after that, you start your F1. So just to put things into perspective, I graduated in June of 2021, I think. I'm not quite sure. I think 2021, yes. So I started my IELTS in May. I sat IELTS in May. I started my eligibility, applied national application, sat PLAB 1 in November 2021, then started studying for PLAB 2 answered PLAB 2 in May of 2022 and started working as a foundation year 1 doctor in August of 2022. A lot of people ask me this question: should I skip the internship in my home country and go straight to the F1 in the UK? It's difficult to say. Everyone has their own thoughts, obviously. For me, it was a better opportunity. I didn't want to get bogged down by the political side of things, because I know in my country, in India, it's a lot of healthcare is politically influenced, and I did not want that to happen. I did not want to work in a system where corruption was a big issue. And so I decided to forego an internship in my home country and go straight to the UK. There are a lot of opportunities that I'm going to talk about soon. And a lot of people also ask me, is the gap year worth it? In the gap year, you're not just doing nothing. You're getting all your paperwork ready. You're studying for your PLAB 1. You're studying for your PLAB 2. You're making sure you have everything set before you start foundation year. So I thought it was worth it. It was definitely worth it. Some of the resources that I used were the UKFPO website, which is the best website you could use. Everything's clearly mentioned. There's a very detailed timeline that you can follow. The Road to UK, there are 2 doctors who actually work in my hospital who talk about their experiences in the NHS as IMGs. Reddit, I would say, is the best site as well. And the subreddit that you would use is Junior Doctors in the NHS. And the Savvy IMG is also a really good resource. So I live in this place. This is the southwest of the UK. It's very beautiful. It's calm, it's peaceful. It's not as busy as London, which is why I like it. This is my hospital. I know it doesn't look very pretty. It's not a pretty sight to look at. It's a grey building. It's very big. But I thought I'd just put it in the background just for context. My foundation year 1 rotations were 4 months in HPB surgery or in hepatopancreatobiliary surgery, 4 months in the medical assessment unit, 4 months in community psychiatry. I'm currently in neurosurgery. It's my final month in neurosurgery. I'm quite sad to move on. I go on to 4 months in hepatology and finally 4 months in GP. So you have a wide range of things, wide range of departments that you can choose to work in. I know someone who's actually currently working in the dive center, the dive chamber, where people who have had significant barotrauma or trauma based on difference in pressures when people dive, come in to go into a hyperbaric chamber, and the doctors there basically look after these patients, and it's very interesting. So there are many departments that you can actually work in, and you can choose to work in. I have friends working in trauma and ortho, some working in peds. So you have your general stuff, and you also got specialty stuff. So my hospital is the biggest center for neurosurgery in the southwest. And so I thought, I actually definitely like neurosurgery. I'm going to try and work in it, try and gain some experience and see what it's like working in this unit. The opportunities that you would get as an F1, as a foundation year 1 and 2, would be you'd be able to assess acutely unwell patients. So you have a lot of responsibility. You see a patient, you assess them, you carry out the investigations needed, you create a management plan. And once you've put your management plan into effect, once you've started treatment for them, you then can have the opportunity to go and speak to a senior and ask them, okay, I've done this. What do you think? Is there anything else I need to do? And that way you get a lot of, 1, you get responsibility. You have responsibility of that patient. 2, you get to learn. As in, if you've done something wrong, they'll tell you. They're not going to shout at you, but they will tell you, okay, I would have done this differently. And there's always a learning opportunity, always. You learn to do simple procedures. So, for example, I've done LPs, I've done aesthetic taps, I've done chest drains, I've done burr holes, which is quite cool. You get to interact with different staff, different departments. And I think this is the biggest part of working in the NHS is actually interacting with other teams. And we have something called an MDT or a multidisciplinary team. And this would be people, so this would be nursing staff, occupational therapists, physiotherapists, speech and language therapists. Sometimes you have dietitians, you have doctors, and you have other healthcare assistants, which form a part of a multidisciplinary team. And this doesn't only have to be in one department. It can be interdepartmental, it can be inter-hospital as well. And it's just learning how to talk to them, learning how to talk to your peers, learning how to talk to your seniors is just a really good learning experience. You can also be a part of the crash team, where you would be called to see any medical emergencies in the hospital. Teaching, in terms of teaching, courses that are offered to you for free are things like intermediate life saving, advanced life saving courses, or ALS, ATLS trauma courses, basic surgical skills, and you have a lot of teaching opportunities. You have dedicated teaching time as an F1, about 1 or 2 hours every week, where you get taught different things, lectures given by esteemed doctors, surgeons, things like that. So there's an endless learning opportunity, and I feel like that's what differentiates a training post from a non-training post. In a non-training post, you'd have to pay for courses like these, whereas in a training post, it's free, and you also have more access to teaching. And as Shan has spoken about earlier, IPS or interpersonal skills plays a big role in working in the UK, because people are I would say the population is slightly more knowledgeable in terms of the fact that they read up a lot about their own conditions. So if you are able to manage a situation properly, even if you don't have, let's say a patient has asked me about what Shan was saying earlier, rectal cancer, and I'm not sure, I still will know how to navigate the situation so that I don't look like I'm a fool, and then the patient starts getting really angry and wants to complain. So interpersonal skills is definitely a big role. So this is just a picture showing. So this picture is a picture of my consultant actually teaching us before the ward round, teaching us different things, us going through the scans. And this is a picture of my registrar also teaching us about some scans and a couple of complex patients. You also do have the opportunity to go to theatre or go to theatre quite often. You get to assist. I was recently, because I'm in the neurosurgical unit, I was allowed to assist with a burr hole. And then the next burr hole I did from start to finish by myself while I was supervised by my registrar. So it's always good to ask for opportunities and take them. You get paid. I think that's the best part of everything. You get paid, and you get paid a decent salary. This is when I wasn't taxed as much. So my salary was £2,759 in a year. In a month. Why am I saying in a year? In a month. And it's a decent salary. It's enough to help me pay my rent. It's enough to help me pay for groceries, enough for me to enjoy some money on the side, and more than enough to put some away for savings. So I would say getting paid is definitely a bonus, a pro. And I would say the best part of it all is that I enjoy a very, very, very good work-life balance. I am able to go to work, come home, and actually leave work behind. I'm able to go out with my friends, have a life outside of medicine. And I think that was really important for me because I didn't want to be overworked to the bone. I wanted to enjoy um, doing things that I always, liked doing before starting to work as a doctor. And I think that was the main, I would say that was one of the main reasons I chose to move to the UK because of the work-life balance. Um, so yes, that's my little bit on working in the NHS as a foundation trainee. If you have any questions, feel free to either type them out or you could even raise your hand, I think. I'm not sure how it works. Harindu is going to help me with this, hopefully. And Shan and I are here to answer any of your questions.
Hi, Trisha, I think you've got some questions on
Already.
the chat
Okay.
box.
All
Yeah,
right. Let's look at them. Ooh, where's it gone? Okay. Someone's asked, once you've picked a department to work in or intern in, can we change it over time or should we stick to what we chose? So once you pick your department, you will pick all 6 departments together before you actually start working. If, for example, you don't get your first choice, you still have to do the first three departments. So you still have to work in the first 3 departments. However, in December, when you're in your second department, there is an option to change next year's choices. So you will be able to change one of next year's departments. But I would say that it's not very easy to change departments. How to maximize our ranks for placement. So before, the UKFPO would organize to have an exam called the SJT or the Situational Judgment Test, and that would rank us. So it was all dependent on how well we did in that exam. Now they've scrapped that and they've standardized it. So now if a computer generates your rank, it's nothing to do with you. You can't maximize your rank, unfortunately. But that also means you have more of a chance to get your first preference. Like I said, a computer does everything. I don't understand how the computer does it. It's a randomized thing. Everyone's allocated a rank. And if your rank is amongst the first, let's say the first 50, they'll allocate you to your first choice. If your rank is from 50 to 100, they'll allocate you your second choice, as in that would be the second allotment that they would start. So unfortunately, there's no way to maximize your ranks. Do we get to choose multiple departments for which rotations are specialized, or do we pick one department and that particular department comes with a set of specific rotations? So like I showed you guys before, so my choices were, I picked general surgery, I picked acute internal medicine and psychiatry. Now in general surgery, I wasn't given the choice of choosing upper GI or HPB, but I was put into HPB, and I think I enjoyed it because on HPB you get to do a bit of general surgery and specialized as well. So you can't, I wouldn't say you're able to choose a specific, you're able to choose a specialty as a broad specialty, and then you can choose to go wherever you want later. Roshni says, would you have to go to UK twice to do the NCA and PLAB too, or is it possible to knock them out at once? That's actually a really good question. The NCA is held in November every year. I think it's held twice a year. I'm not 100% sure. I didn't have to do it, so I'm not 100% sure about it. But I have a friend who is currently answering the NCA. Now, she is in the UK at the moment. So for her, it's really easy because she's going to do the NCA now and then PLAB 2 in May. So unfortunately, I think you have to come to the UK twice to answer the NCA. Yeah.
I'll be also mentioning about I think Tisakia, right? Tisakia's question. I think
Yeah.
With my pathway, it's a bit more flexible because we get to choose our own department. For example, when I was applying for jobs, I didn't want to do pediatrics nor gyn obs because number one, my exposure is a bit low and I have no idea in progressing. So that's why I mostly chose medicine, cardio, respi, acute medicine, internal medicine. So in my pathway, you have a bit of flexibility, and I believe answering to Roshni's questions where you can, it's Roshni. Okay, answering to the other question, again, Tisakya, you can change. For example, I got 6 months in medicine and 6 months in surgery, and I opted and I requested them if I could work in an acute medical setting and then, go ahead. And they were, quite flexible because they did have some vacancies. So I believe there is a bit of flexibility rather than going through each departments. But then, as Trisha mentioned, since she's in trainee, she has to fulfill certain criteria. So she's into that pathway. A bit more flexibility with my job, but training is more and better in Trisha's.
Okay. Is there any other questions? Okay. So if you guys have no other questions, we will sum it up now. And if you guys have any other questions, you can definitely text me and ask as well. And if you're interested in joining our course, we are going to start in November 30th with OET, and then we're going to start with our PLAB lecture, UKML lectures in January. So to know more information about it, or any of the guidance or the registration process or anything, you can ask us. So we are the admins of the group, so you can message us and ask anything. All right then. Another thing that you guys have to keep in mind is, now if you have already passed PLAB 1 or IS, and if you have already done your internship, you might as well book your exam on the November 18th, because on November 18th they'll be releasing seats for the PLAB. And if you guys have missed it, and if you are not eligible for that date, then you have to focus on doing your OETs or IELTS right now, because the next seats will be released in February. So why I'm urging you to book this as soon as possible is because the exam is going to take another year of your time. And it's always better to book it and keep it, and within that 1 year then you can prepare, you can get enrolled into a course, or you can do your own work and all of that. So just get it out of the way, and then then it'll be easier for you. Because most of my friends and most of the doctors who want to do it, they keep procrastinating. They keep okay, let me just book it when I feels like it, or whenever I want to do it. But they don't know that you need to actually book it 1 year prior, and then once they get to know this, they will like, okay, I have to stay 1 year now, what should I do? So they'll be asking so many questions. So that is why I'm urging you to get it done and keep it out of the way, and you can do your day-to-day things, and then you can do it after 1 year, the exam. Okay, so that will be it. And if you guys, like I said, have any questions, just drop me a text, and we are happy to help you guys out. Okay, then thank you for joining from all around the world. I think we have doctors here from Malaysia, India, and in the UK as well, and also in Philippines as well. Okay, so nice to meet you guys, and good night and have a good day. Take care, all of you. Okay, bye-bye.
Take care, bye.